Go ahead.
Hi, my name is Katie and I'm with speech therapy. How are you today?
I've been better, but I'm living through it.
Okay, well, I'm going to ask you a few questions, watch you eat and drink some things. Is that okay?
Yeah.
All right, so tell me your first name.
Bradley Jackson.
And Bradley, where are you at right now?
I'm at the Fort Wayne Hospital.
And what brought you here?
I passed out on the football field.
All right, well, that must have been scary. I'm glad you're doing better. So the doctor sent me in today to assess your swallow safety, so I'm going to ask you to do some different tasks today. Follow some directions and I'll take a look at how your chewing and swallowing muscles are working, and then I'm going to have you drink some different liquids, try some different consistencies to see if we're good to return you back to your normal diet. And I'm going to explain everything as I go and what I'm looking for. Do you have any questions for me?
No, sounds good.
All right, so first I'm going to check to see if you're on any supplemental oxygen, have a trach tube, or high respiratory rate, which would be 30 or above, and it looks like you're breathing just fine, which is important for airway safety. And have you had any difficulty with chewing or swallowing lately?
No, not really.
Any choking on liquids or foods, or coughing after you're eating?
No.
Okay, any history of unexplained respiratory illnesses? Any unexpected weight loss? Any unexplained fevers? Alright, everything's looking good so far. So next I'm going to look inside your mouth, so I just want you to say ah. Alright, go ahead and stop. And in this oral, I'm going to have you continue to open. Alright, so I'm just looking to see if you have any broken or missing teeth in this oral neck exam, and then also if you have any thrush, any lesions, or any swelling in there. Then I'm also looking to see if your soft palate elevates, so that way when you swallow, no food goes up into your nasal cavity and out through your nose. And then next I'm going to do a cranial nerve exam, which just tells me if your brain is connecting with those cranial nerves to activate those chewing and swallowing muscles. And I'll check for strength and range of motion while I do that. So first I'm going to have you stick your tongue straight out. Good, and then next go side to side. Alright, and then I'm going to have you push your tongue against my hand on each side. So I'll have you push against my hand on this side, on this side. Okay, and then open your jaw against resistance. Good. So that's telling me cranial nerves 5 and 7 are intact. And it's looking like good range of motion and strength. Put back on a glove. Next, I'm going to have you swallow against my hand. Alright, so I'm going to have you swallow your saliva. Alright, good. So I felt laryngeal excursion there. Then next, I want you to say ah until I say stop.
Okay.
Go ahead and stop. So I'm just looking for vocal quality there. All sounds good and clear. No hoarseness or wetness heard in that. Next, give me a strong, productive cough.
Okay.
Alright, nice and sharp. So that's telling me that you have good laryngeal movement, which means cranial nerve 10 is intact. And then also with that nice productive cough, that's telling me you have the ability to clear your airway. Something goes down that wrong pipe. Alright, next I'm going to give you a few items to eat and drink. So first I'm going to have you take a bite of this applesauce. Alright, so laryngeal elevation, which means that you swallow. So I'm going to have you open wide and then take a look in your mouth. Okay, I'm just looking for any oral residue, not seeing any, so that's good. You have good clearance there. Next I'll have you take a sip of this thickened water. Alright, good, no coughing, which is good. And then since you're more alert and awake now than you were in the hospital, I'm going to have you drink 3 ounces of this water. Let's have you drink, drink, drink until it's all the way gone. Alright, awesome job with no coughing. People with dysphagia or difficulty swallowing will usually cough during that task, so that's great. Last thing I'll have you do today is chew and swallow this cracker. I'm going to look for oral residue again.
Okay.
Alright, good. No oral residue noted. You're trying chewing was timely. Do you feel like anything stuck in the back of your throat at all? Alright, so I'm gonna write this up and let the doctors know, but it looks like you're ready to return back to your normal diet. I don't suspect any risk of aspiration, which is when food goes down into the wrong pipe and into your lungs. Tomorrow I'll come and check on you though to see how you're doing after a full meal. I do just have a few suggestions to keep you safe while you swallow. So making sure you're fully awake when you are ready to eat, and keeping in mind that medicines can make you drowsy. And also taking small bites and making sure you're taking your time while eating, and then just sitting upright after eating. Do you have any questions for me?
No, thank you.
Alright, you're welcome.